Hi, my name is Dr. Jamie Adam, and I teach pharmacology. And today I want to talk to you about potassium. And potassium is a very important electrolyte. It's a very important mineral that all of us need. But when we think about potassium as a medication, there are some really important things that we need to remember. So I'm going to take a minute and go through the 5 things that you need to know about potassium, especially when you are administering potassium as a drug. So, number one, anytime someone has a potassium abnormality, I want you to think heart and muscle because those are the symptoms that we see when the potassium level is too high or too low. We can see EKG rhythm changes, cardiac rhythm changes when that potassium level is too high or too low. We see muscle complaints. There's lots of other symptoms our patients may have, but when you see heart and muscle complaints, you want to think potassium abnormality. Also, I want you to know that the best way to replace potassium is really in the diet. That's the number one way to correct a potassium abnormality, especially if it's just slight. If it's a subtle hypokalemia, then really the diet is going to be key because that's how the body absorbs it best. And potassium can be found in a lot of different foods, but especially your green leafy vegetables like spinach, bananas, potatoes, lots of things like that. Lots of different vegetables have potassium in it, and that's what we want to encourage our patients to eat if their potassium level is a little low. Now, if we decide that if the provider orders potassium supplement, now we're talking about the patient receiving potassium in the form of a pill or a powder. And when that happens, there's something that you need to remember with oral potassium, and that is that it's very hard on the stomach. Your patient is probably going to complain about upset stomach when they receive oral potassium. It's very common, it's very classic, it happens all the time. And one of the best ways to help with this stomach discomfort is to encourage the patient to take it with food. So, this is one of those medications where taking it with food can make a big difference in how your patient feels and also in their adherence, whether they comply and take it every day as they're supposed to. The next thing I want to point out is about IV potassium. Now, IV potassium is generally reserved for potassium levels that are really low. So, if your patient is really low, if their potassium level is well below normal and they're symptomatic, they're having cardiac changes, they're having severe symptoms of hypokalemia, then your provider may decide to give potassium IV. And if so, one of the most common complaints with IV potassium is a burning or a stinging sensation in the IV, kind of right where that medication is going in. In fact, if your patient says, "Ooh, like my arm is hurting or my IV is hurting, is something wrong with this?" That would be a fairly typical common complaint that you might hear from a patient. And that's because IV potassium can be very irritating to the veins, and it's very common that it causes phlebitis, which is inflammation or irritation of the vein. So if this happens, you can apply a cool compress to this IV site to where that pain is, and that can help with some of the discomfort. Sometimes we have to slow the IV infusion down, and in the worst cases, we have to stop or discontinue the IV and start a new IV in a different area just to give that vein time to rest and heal. So it depends on the patient, how they're tolerating it. Maybe they've had to receive potassium several times IV, and over time, that vein has just become increasingly more irritated. But that pain with IV potassium is actually fairly common, so something to watch out for. And then the last thing has to do with IV potassium safety. So, if you administer IV potassium, IV push, undiluted, that can actually stop your patient's heart. So, in order to avoid that, we always dilute potassium and we always give it over time. And so the recommendation is to dilute potassium 10 milliequivalents in a 100 milliliter bag of saline and infuse it over at least 1 hour. And so that's commonly referred to as a potassium run. Now, nurses aren't usually diluting potassium. This is something that would come already diluted from the pharmacy, and you would be administering it. But you would be responsible for setting up that pump correctly to make sure that that potassium goes in over an hour, not all at once. It's very important that it go in over time so that it can go in safely and not cause any dangerous cardiac abnormalities. So, I hope this has been helpful to you. This is just a summary of potassium. Now, you might be thinking, oh my gosh, like pharmacology is tough, nursing school is tough. How do I study for nursing school? How do I make sure that I know that I'm doing everything I can to get A's on my test, to pass all my classes? Well, I've created an ebook just for you, and I want you to click on the link below, download it, and get started and work through it. It's going to help you know exactly what to do so you can be ready for your next test, get A's on your exam, have decreased stress. Oh my goodness, nursing school without stress. What an amazing thing that would be. So, you can get that right there down below. Also, like, subscribe to my channel. I don't want you to miss any helpful tips and information. Anything I can pass on to you to help you with pharmacology is going to just make your life so much easier. So please like and subscribe and share this video with others. Thanks so much. Bye-bye.